Now, whenever we discuss low libido or low sex drive in men or sometimes women, two things always top up the list, and that is stress and depression. Now, because these things happen in the mind, it is good we discuss them, because sex apparently happens in the mind too before it moves down to the genitals, okay? But they are not the only causes or the only reason why men have low libido. We have other reasons like anxiety, chronic illnesses, we have, health issues and stuff like that, and we want to discuss them in today's episode. My name is Ronji, and I welcome you to my show, Ronji Health Tips, where we give you information on matters health. And in this particular episode, we want to give you information that is not only going to benefit you, but hopefully it benefits your sex partner if you have one, and in a beautiful way, okay? So stick to the end and let's discuss what is important for today. When we talk about low libido, we are basically talking about low sex drive. The interest of having sex is at minimal or it's non-existence. And there are many factors that contribute to that, okay? And so we want to look at them one by one. We have at least 7 to discuss today. Number 1 is stress and depression. Number 2, we have sleep disorders. Number 3, we have chronic illnesses, which may cause libido to be low. Number 4, we have anxiety. Number 5, we have low self-esteem. Number 6, we have alcohol and drug use. This we've talked about in this channel before. And number 7, last but not least, we have aging, okay? We have to accept that nature is taking its course. And so we have to look at how age affects low libido. Low self-esteem may affect your sexual drive. This is because you perceive yourself not to be enough, not to be attractive enough. And we usually used to think that this affects only women. Apparently, it affects men too. You look at the mirror, you don't like what you see, and it takes away your desire for sex. You feel undesirable, you feel unwanted, you feel like you're not enough. And this can take away, this can make you to lose interest in sexual matters and to reduce your participation in sexual intercourse. Another thing that affects your sexual drive is anxiety about your sexual performance. Now you need to relax, okay? Nobody is perfect, and when it comes to sex, a lot of things are not perfect. The most important thing to remember is that you are there to make yourself happy and to make your partner happy. Sex is not going to feel the same way every day. There are days when you enjoy good sex, good coordination, everybody comes and feels really good. And there are days whereby you get through it and you look behind, you analyze it, you feel like you did nothing. And it's okay. It's natural. It's okay. You need to relax. Don't get worked up about it, because if you get worked up about it, it means it's going to affect your next performance whenever you try to do it again. If today it didn't come out, it didn't play out nicely as you expected, it might tomorrow. So there's no need to worry. Relax, that's your person, understand each other, and leave all the anxiety out of it, okay? When you are less anxious, you are more likely to even perform better. You are likely to give a good game, and when you are anxious, you're actually going to perform poorly. So relax. The secret to anxiety is to just relax your mind and go at it as you are going to have fun. When it comes to alcohol and drug use, we've discussed this on our last episode. We've said alcohol in the long run affects your sexual drive, okay? So all you need to do, this is very easy. All you need to do is to adjust your drinking. If you've been taking a certain amount of alcohol, you need to bring it down. If you are experiencing erectile dysfunction and low drive of sex, you need to bring your alcohol intake down so that you get back to the rhythm, okay? Now, when it comes to age, we understand that your testosterone levels go down with time. When you were much younger, they were high. And so it was easy to get into this stuff. We are talking sexual intercourse. Now, as you age, it becomes more difficult to, get an erection, to be aroused, to get an orgasm or to even ejaculate. And that's okay. And when you experience that, that should just tell you that you are aging well, because it's common and it's very natural to experience that in your older years. Although we are not saying it's impossible to get these things. You can still ejaculate, you can still, get aroused, only that it's not going to happen as fast as it used to happen when you were much younger, okay? And so you don't feel frustrated. You might want to have a partner who will laugh it out with you, you know. Not all the time things will happen the way you want them to happen in the sexual arena. You are not alone. A lot of people experience this when they are aging, and so take it one day at a time when it comes to that. If you're not sleeping enough and if you're experiencing low libido, that could be your cause right there. You need to adjust your life so that you get enough sleep if you want to improve your sexual intercourse and your sex life in general. When you don't sleep enough, or when you don't sleep at the same time every day, that can affect your sexual drive. You need rest. I know men are out here working so hard for their families, and with the kind of economy that we are experiencing today, it is even difficult for them to get time to rest. But you need to rest. You need to, you know, make sure you are having enough sleep, because apparently when you sleep, your testosterone levels go up. And when you wake up in the morning, they are up already, and they give you a good chance of having a good sexual intercourse. So chronic illnesses like, let's say for example, cancer, it may affect one's libido, because you are always constantly under healthcare, you are always using drugs. These drugs may affect your sexual drive in the long run, and because you are using them consistently, your sex drive could come down really fast, and it may stay down for a long period of time. Depression is a mood disorder that affects pretty much everything in your life, including sexual activities. It makes you feel like not doing the things that you were motivated to do before. It puts you down, you feel kind of sad, you feel angered, and it is an unstable condition whereby it will hinder you from having sex with your sexual partners. You won't even have the drive to want to have sex. Now, when it comes to treatment of low libido, this is what you are waiting for all along. When it comes to treatment, there is hope, because there are medications to help with low libido, but it will depend with the underlying reason why you are having or why you are experiencing low sex drive in your life, okay? If the reason is medical, you might want to check with a doctor. If you're using drugs whose side effects may be giving you low libido, you might want to check out with your doctor. And I have two that I can refer, okay? Two very experienced, you know, both male, who can help assist with your issues. Just reach out and we'll assist you. If your reason for low sex drive is stress or depression, again, you might want to visit a therapist, sit down with him or her and discuss your issues in confidence and see what you can do when it comes to your relationship issues, okay? You might need to open up to somebody you trust. It might be your partner. Have that conversation that you so long need to have, so that you bring your sex game back to where it's supposed to be, okay? If the reason is out of lifestyle, we've talked about drugs and alcohol abuse, you know what to do. Bring it down, okay? If your reason is because of lifestyle, you know, you're having no exercises, you're eating all the wrong things, you might need to adjust that too, okay? Start eating proper food. We've discussed proper food on this channel. Go ahead and go through the videos we've talked about, you know, healthy foods full of fiber, fruits, vegetables and stuff like that, nuts and stuff like that. Start exercising, even if it is just, you know, 20 or 30 minutes a day for at least 4 days a week. Do something about it, okay? You'll be surprised how much you're going to improve, not just your sexual life, but your general health. So that is something you can do, and I trust you're going to do. And let me hear from you guys. Talk to me in the comment section. Have you ever had a low sex drive before? Did you take care of it? What did you do? Did you talk to somebody? Did you do any of the things we've recommended? Talk to me. Let's know what you did. Share with us. If you're having an issue right now as we speak, if you're experiencing low sex drive, you know, you're not interested in matter sex, you're not interested in having sexual intercourse with your partner or your partners, talk to me. What can we do for you? We can refer you to see a doctor, we can refer you to see a therapist, we can look at your issues and know what to do with you, okay? So reach out, don't be afraid. But it's been nice catching up with you guys, and let me hear what you have to say in the comment section. If you haven't already, go ahead and subscribe to the channel. This is your #1 health channel. We give you issues that could be helpful to you or to somebody you care about, okay? So go ahead and subscribe, turn on that notification bell, and we're going to meet again on another episode. And until then, God bless you.